A 10-month-old infant is brought to the pediatric clinic because of poor weight gain. His parents are concerned that he looks smaller than other babies his age and has not outgrown his clothes for several months. They report that he feeds slowly, gets tired easily during feeds, and often refuses solid foods. He has frequent loose stools but no vomiting or fever. On examination, the infant appears alert but thin. His weight is below the 5th percentile for age and has crossed down 2 major growth percentiles since his last visit. His length is mildly reduced, and his head circumference is at the lower limit of normal. There is decreased subcutaneous fat over his arms and thighs, giving him a wasted appearance. Developmentally, he is slightly delayed. He can sit with support but has not started crawling yet. There are no obvious dysmorphic features or signs of acute illness. Cardiac and respiratory exams are normal. This presentation is consistent with failure to thrive, a condition defined as inadequate growth due to insufficient caloric intake, poor absorption, increased metabolic demand, or a combination of these factors. Common causes include feeding difficulties, improper formula preparation, chronic diarrhea, malabsorption, congenital heart disease, and psychosocial factors such as neglect or food insecurity. Initial evaluation focuses on a detailed feeding history, growth chart review, and observation of feeding technique. Basic laboratory tests may be ordered to look for anemia, infection, or malabsorption. In this case, poor intake and frequent stools suggest inadequate nutrition and possible malabsorption. Management requires a multidisciplinary approach. The family receives nutritional counseling with a high-calorie feeding plan, close follow-up of weight gain, and support from a dietitian. Any underlying medical or social issues are addressed. With improved nutrition and monitoring, the infant begins to gain weight steadily and shows progress in development. Key takeaway: failure to thrive is identified by poor weight gain and crossing of growth percentiles. Early recognition, careful evaluation of feeding and underlying causes, and nutritional intervention are essential to support normal growth and development.